Hi, everyone. Today we're going to talk about cognitive behavioral therapy. So give me a second as I open slide. Okay. Okay. So here we're going to focus on cognitive behavioral therapy, also known as CBT. In certain parts of the world, you also may be your cognitive behavior therapy, again, CBT. What we're going to be focusing on today is this term contains a lot of different approaches to promoting growth and change, as well as dealing with mental health disorders, mental health illnesses, and promoting wellness with people's thoughts, behaviors, and feelings. So, questions we're going to be exploring today. First off, what is CBT? Right, we're going to be talking about that. Also, spend some time discussing how CBT can work, and so we're going to be focusing on the hallmark of CBT is addressing thoughts, feelings, and being aware of our thoughts, feelings, and our behaviors. And then finally, how can we use CBT to promote growth and development? So before we begin, I want to start with some reflection questions. So take a moment. You can keep this to yourself, write it down, whatever works best for you. But starting point to begin is when you hear the term cognitive behavioral, what comes to mind? Now, you may be already familiar with CBT through your schooling, being a psych undergraduate. This was probably covered in some other classes. In addition to, if you're interested in this topic, you have maybe experienced CBT as a client within a therapeutic relationship, or just know this term because CBT is pretty popular. In addition to, we see the use of CBT not just with trained mental health providers like psychologists, social work, counselors, etc., but also we've seen CBT used in other helping disciplines, nursing, occupational therapy, etc. So again, with all that being said, reflect on what thoughts do you have that you're bringing to this session about CBT. Relatedly, I want you to go back to your Intro to Psych course and what associations do you have with behaviorism? So, what are your thoughts, feelings about concepts such as Pavlov's dog, where we're doing classical conditioning, or Skinner boxes, where we're using operant condition. Essentially, again, remember, behaviorism is the study of how people and organisms learn through some sort of external reinforcements or manipulations. And as we're talking about today, too, the final thing I want you to think about is to look for uh, what diagnoses, again, you've already taken um, well, I just lost, oh, abnormal psychology, where we talked a lot about the DSM-5. And think about when your knowledge with the DSM-5, how could those diagnoses within the DSM be treated with cognitive behavioral therapy? So now we're going to focus on what we mean by CBT. And the history of CBT is rather important because there's three major time periods that have really influenced how we utilize this particular therapeutic modality. So again, knowing with the history of psychology, especially within the United States, the 1900s, so the start of the 20th century, we saw a boom in psychology being the study of behavior, hence behaviorism. And so, with this, the idea of the study of behaviorism and knowing how organisms learn, and through that learning, they can adapt and change and add new behaviors, it started to apply this concept within a clinical setting. So, again, behaviorism is highly influenced by classical conditioning. So, that's the classic Pavlov dog, where with classical conditioning, we can take a natural response in the body and cause that response by an external stimuli. So, what I mean by that, thinking of Pavlov's dogs, they naturally salivate right before they're about to eat. Okay, so that's a natural reaction. And we can cause that salivation by having association with food. So, when someone walking by who is about to feed the dog, the footsteps are a trigger to start salivating. That's classical conditioning. Operant conditioning, again, this is the Skinner box, where we can use reinforcement schedules, behaviors, and punishments to change how someone and something learns. So, if we want a pigeon to engage in certain behavior, we're going to reward them with food when they engage in that behavior. That's operant conditioning. So, again, the first wave of CBT was rather the B part, behavioral therapy. And what this does, the behavioral therapy, is focusing on changing specific behaviors, either using classical conditioning, operant conditioning, or whether reinforcement and exposure. A very prominent form of behavioral therapy that is still used to this day is exposure therapy. And we're going to talk more about that in just a few slides. Now, as we know with the development of psychology, in the early days of the field, especially in the 1900s, particularly the 1910s, 1920s, famously, J.B. Watson, who was a big pioneer of behaviorism, essentially stated that we're not necessarily interested in the mind per se for psychology. We don't need to know what's going on internally to understand how people still change and through their behavior. Behaviorism, we observe things and we can manipulate their environment. We don't necessarily need to know what's going on internally. But as the field started to progress, and then we had improvement in different technologies and understanding of humanism and understanding of behaviorism per se, we get to the point where the field starts to shift from really trying now to understanding a larger picture of humans and larger picture of how living beings behave. Behaviorism wasn't enough to explain everything. And so then we start to have the birth of cognitive sciences. And cognitive sciences, especially in psychology, focuses on understanding how people think and the processes of thinking, aka cognition, and how that occurs. And we also see this within the clinical side that uh, different approaches to understanding humans start to get integrated into psychotherapy, particularly in this correlation or this connection with CBT. One of the major pioneers what we have is what we call rational emotive behavioral therapy. And this is by a psychologist named Albert Ellis. Albert Ellis was very inspired by classical philosophy, such as Stoicism, rationalism, this idea that really we can our thoughts and how we make sense of the world and engaging in rationality, hence the rational side of REBT, is very important of how someone behaves and interacts with the world. And so with this too, and additionally, we start to see this birth of cognitive therapy by Aaron Beck, I believe. Cognitive therapy, again, is we're going to focus on how people think about their current situation and realize that thinking itself can sometimes not be as effective as we like. Stinking thinking, in order, if we think negative thoughts, that's going to result in depressive behaviors and and continuing with that. So essentially, with the second wave of the cognitive revolution, we start to see that therapy starts to turn into this element of if we change one's beliefs, we're going to change one's behavior as well as emotions. So that was a very prominent component, a big focus from the 1960s and 1980s. Around the 1990s, we have a third wave of CBT, and this is called the contextual element. So we're building off studying, influencing the how the environment influence behavior to how our thoughts influence behavior. And then now this is the third wave essentially focuses on how our awareness of ourself, of our thoughts, of our environment also is a tool to promote growth and change. Because if we don't, in order for behaviors to change, we need to change the environment, we need to change our thoughts. But a precursor to that, in order to do this, we first must be aware of our environment and aware of our thoughts in order to change them. So, the third wave is what we call the contextual wave. And this is inspired by a variety of other clinical approaches as well as contemplative science. So, right now we're focusing specifically on the evolution of CBT. But it's important to take a larger picture and step back that as CBT was going through these waves, we also have the development of other approaches to therapy, especially clinical mental health therapy. A big component at this time was what we call person-centered or humanistic therapy. And the hallmark of basically person-centered or humanistic therapy is the focus on the relationship. And a lot of research was done to the point now that no matter what approach you use in therapy, every clinical modern approach really stresses that the relationship is very important and the relationship also fosters growth and change. So a third wave adapts that. And then in addition to the humanistic side, we also had and psychoanalysis, also the umbrella term psychodynamics, and then relatedly we had this approach called Gestalt therapy. And both of those approaches were really focusing on the power of awareness. In order to change behavior, we must be aware of behavior. Freud variously said, uh, to change the unconscious, we must make the unconscious conscious. And the Gestalt therapy as well was we bring awareness of the different components. And if you become aware of something, by being aware, you have more ability to manipulate, to take control, to change. In addition, around this time too, mindfulness and meditation starts to become a stronger focuses within clinical and psychological sciences, studying the impacts of mindfulness and how beneficial mindfulness can be for well-being. We call that the contemplative sciences, where it takes the scientific rigor of, methodology, etc., and applies it to traditional approaches to wisdom, such as yoga, mindfulness, meditation, etc. So all of these components start to influence CBT, and then we have this third wave where it's now focusing on the relationship we have with not just our thoughts and behaviors, but relationship with others, as well as having the awareness of our thoughts and behaviors through metacognition. Again, we talked about this in our intro to psych, where metacognition is the ability to think about our thoughts. So thinking about our thinking. And that ties to the mindfulness and awareness piece. So to sum this all up, originally with CBT, starts off with behaviors. If we can change the behavior through manipulation of the environment. Now we shift to adding to that too, in addition to manipulating the environment, we change our thoughts. That also changes behaviors. And then third component is by adding the awareness of our thoughts and our behaviors can also, in a way, be an important catalyst to understanding our thoughts and our behaviors. So, to give an example of third wave CBT, we see the birth of dialectic behavioral therapy, which is a heavily mindfulness-based approach. And DBT was originally designed and then popularly used for specific conditions in the DSM, particularly bipolar or borderline personality disorder, BPD. So DBT became a very standard treatment for that. And DBT has been used for different approaches or different conditions as well. But that was kind of the hallmark for it. In addition, we saw the creation or the advent of what we call ACT, which is ACT. ACT is a form of acceptance commitment therapy. It's really stressing that idea of building relationships with the thoughts and taking a metacognitive view and then accepting that sometimes we may not be able to change our thoughts, or it's natural for us to have certain thoughts. There's a relational element, an acceptance element of our thoughts, actions, and behaviors. In addition, we also see the advent of mindfulness-based cognitive behavioral therapy, which uses the contemplative sciences and integrates them into a CBT framework. So CBT is a huge umbrella. There's a lot of various excuse me, there's a lot of subspecialties of CBT, as I already mentioned. As you'll see too, we're not going to focus on today, but there's a specific type of CBT called trauma-focused cognitive behavioral therapy. In addition, we can have CBT for sleep hygiene or insomnia. You name it, there's probably some sort of CBT connected to some sort of mental health disorder. So, to sum that all up, and what we're going to continue talking about today, is it's important to view CBT through the lens of a triangle. And what this means is that this triangle is made of 3 points. The points are behaviors, thoughts, and feelings. As we talked about time and time again, they're interconnected. So no matter what wave you're focusing on, if you change one, let's say behaviors, that's going to have some sort of impact on feelings and thoughts, and vice versa. You change thoughts, that's going to change behaviors and feelings. So, with this, we're going to focus on the various waves that we talked about and have the cognitive behavioral triangle in mind. Again, we can be strategic with the idea of the triangle. If I change one, it's going to change the others. So, first, we're going to focus on changing a specific behavior. And this is the hallmark of behaviorism back in the day, exposure therapy. So, exposure therapy is this idea that we know that phobias sometimes really fall into what we call operant conditioning, or they're conditioned. What this means by this, when we study phobias, the fear of something, avoiding that fear actually strengthens the fear response. So, what I mean by that, let's say the more someone is afraid of going outside, the more they avoid anything connected to outside, that strengthens their behavior of avoidance, which strengthens the worry and fear of the outside. So we can break that cycle by actually exposing someone to their fear. So that's gradually occurs. So commonly with exposure therapy, we're talking about some side of phobia or anxiety. So let's say we're talking about fear of spiders, fear of air travel, fear of social spaces, whatever fear it may be, we're going to gradually expose people to some sort of fear-inducing stimuli. A good starting point is typically sometimes a picture of that fear. So if you're fear of spiders, we're going to start working in a therapeutic setting to have you actually look at a picture of spiders. So this is a way to remember is you're going to insert your phobia here as a picture. For me, the Chucky doll was something that was definitely afraid of. And so, warning, I'm going to show the photo of Chucky's going to appear on screen. So, in theory, by having the fear of avoidance of Chucky, exposing myself even to a photo of Chucky is going to help reduce that fear. And we're going to build off that fear. Maybe it's now going to watch a child's play movie, and then the final stage would be to hold a Chucky doll. And just think about it. If someone has a fear of Chucky, probably the most overwhelming anxiety-inducing component would be actually being physically present and holding that doll. Now, if they get to that stage where they can hold that doll, and lo and behold, Chucky does not come alive and try to kill them, then most likely they're not going to be as scared or as avoidant of Chucky anymore. So that's the idea. We're going to slowly, gradually build up exposure to this fear creating stimuli. Now, here's the thing. It is a delicate balance sometimes because exposure therapy requires confronting the anxiety to the point that someone has to feel anxious enough, has to have that stimuli response, and being present with a changing environment, dealing with that response, starts to have that thoughts of, you know what? Yeah, I was very anxious, but that wasn't that bad, or I made it through. Again, the thoughts, we're changing by engaging with the behaviors, thoughts start to change. So, with this, what I mean by that is you have to have some level of anxiety and uncomfortableness through the exposure in order for the exposure to work. But we want that at a tolerable level. So a little step outside their comfort zone. 1 foot, if you will. Both feet, though, may be too overwhelming, what we call flooding. If we flood someone with too much fear and anxiety, and they realize then that they start having thoughts that justify their avoidance, then that is not helpful. So we want an environment where there is enough anxiety that they can get through that anxiety, which is going to lead to thoughts that, you know what, I can do this. I can face my fear. But if we have too much anxiety, the response is not going to be I can face it. It's rather I can't face it and or I am justified in avoiding this fear. So that's the tricky balance. That is for sure a tricky balance. So that's exposure therapy. Now we're going to focus on a common cognitive technique. Okay, exposure is very behavioral focus. We're using some sort of external stimuli. With cognitive approach, we're going to address the cognition. A common thing is called reframing. So now we're specifically looking at thoughts that someone has. Uh, as you can see on the screen, I have an image from Finding Nemo, and this is Bruce the shark. And then Bruce the shark is really trying to improve his life, and he no longer wants to eat fish. So he wants to change that behavior. And in using a way to change that behavior, Bruce uses a mantra. And the mantra is fish are friends, not food. That's a reframing technique. He's trying to change his behavior by changing his cognitive association with fish. They're no longer food. That was his baseline thinking. They're now friends. So fish are friends, not food. It changes his thoughts, changes his behaviors. So this technique of reframing, how it starts essentially is you first notice the thought, you question the thought. Okay. So for Bruce, he first notices, damn, I feel, I want to eat fish. I don't want to eat fish anymore, but I feel the urge to eat fish. So then he's going to question that. Well, f fish are not really food anymore. They're friends, and I don't want to eat my friends. So then he reframes the thought of fish are friends, not food. So we have the thought, we question the thought, and then we challenge, reframe the thought. So that was the cognitive wave. Now we're going to focus on the third wave or the contextual thing. So we're going to engage in a mindfulness activity now. So take something that you can put in your hand safely that's not going to prick you, stab you, cut your hand, whatever. Something safe to hold in your hand. Something small enough where you can move it within your hand as well. You're going to take the item like a rock or a pen cap, piece of candy, wrapped, hopefully. You're going to hold it in your hand, okay? Now, without looking at the item in your hand, try to create a mental image of it. Okay? So think about that rock in your hand. Think about the pen cap in your hand, the wrapped piece of candy. Now move it around your hand without looking at it. Then notice the different textures. Maybe there's even a different sense of sensation, a different temperature. Maybe hear the crinkliness of the candy wrapper. Okay. Notice it on different parts of your hands. Move the item with your fingertips. Caress it with your palm. Okay. Notice those different sensations you're experiencing. Now focus again. Keep focus on that item. Now with the focus you have on the item, I want you to shift that focus to your current body. How are you feeling at this time? Okay. That's a brief mindfulness activity. We go from focusing on an object, which can help decrease our thoughts. We're improving the awareness of ourself. And then by focusing on one thing and then shifting it to who ourself, we can have now awareness of how we're currently feeling. Maybe you're feeling more relaxed. Maybe you notice a difference in your breath. So this is a brief kind of mindfulness activity to integrate that. So those are the three examples of the different waves or flavors of CBT. Now, a common hallmark of CBT too is we have a lot of manualized care. So there's a lot of guidelines of how we engage in promoting changes in thoughts and behaviors and feelings. Exposure therapy is very manualized, like I said. Same with reframing, same with mindfulness. There are a plentiful element or array of books out there, and many times what we utilize in CBT, in addition to the manuals, is there are homework slash worksheets that clients will be given that they can utilize outside sessions. So this is pretty prevalent. And those worksheets could be focusing on behavior changes, cognitive changes, more mindful changes, whatever it may be. There are plenty of activities that are utilized outside of the therapy session and then may be brought in back into therapy to review to see what worked, what didn't work, etc. So it's a very common hallmark of cognitive behavioral therapy. And within our Brightspace page, I have multiple examples of CBT worksheets and manuals to inspire you. Because with the assignment for this week, you're going to use today's lectures and the materials I referenced on Brightspace to create your own CBT worksheet. Try to aim for a page or two. Okay, don't get too complicated with the length, but you can have some creativity. You want some cool pictures, some fun activities, whatever it may be. So there's going to be two parts to this. One, you're going to create the CBT worksheet. Again, a page or two. And then you're also going to, so you'll create that and you'll submit a clean copy to it. What I mean, doesn't need to be filled out. The worksheet doesn't need to be completed. I want to see the OG worksheet, have it, clean copy. You'll submit that. In addition to the worksheet, you're going to submit a two-page reflection paper. And with that reflection paper, you're going to detail what the process was like creating the worksheet. Okay. So, what inspired you? What ideas did you have? The process of the creation. Was it easy? Was it hard, etc. In addition, you're going to talk about too how you imagine this worksheet would be used in a clinical setting. So again, connecting it to our knowledge of abnormal psychology and the DSM, how could you see this utilized within a clinical setting? Is it being used to treat a specific mood disorder like anxiety, depression? Is it used to treat behavioral? Maybe we have obsessive compulsive elements or BPD, whatever it may be. Focus on that component. And then for what specific purposes? So, how could you imagine this being used? And then for what? Okay. All right. So, well, there's the references for today, and we're going to end there. All right, all. I hope you have a good rest of your day, and I'll see you soon.